Congresswoman Susan Wild had a town hall meeting tonight. I signed up for it. It was at 7 p.m. I got on the call without any problem, and I pressed 0 to ask a question, and then I pressed to go back, and I hit disconnect instead of back, and I cut myself off from the call. Totally my fault. So I wanted to do a video of what the question that I had, that I would have had I got to speak at the town hall meeting tonight. And the question was on the pandemic. This pandemic is harshly changing our society, and its effects will go on well into the future. What's happening in America now is also happening around the world. A recent article in the Irish Times quoted 2 prominent Irish doctors, Dr. Martin Feely, who is a clinical director of Midland Fields Hospital Group and a senior executive of Ireland's government-funded healthcare system, wrote, "The lockdowns that we were told were essential can no longer be justified in light of what we now know about COVID-19." End quote. The lockdowns, he added, disproportionately harm the youth. And, quote, "You can't postpone youth," end quote. The final financial cost, he said, can be seen in any walk or drive through cities, towns, and villages. Mortgage repayments and other financial setbacks are virtually all suffered by the young worker or business person, and not by the over 65 who are guaranteed their pensions, as indeed are the salaries of the individuals who decide to inflict these draconian measures. Dr. Feely condemned the obsession with, quote, cases as a contextless number that only panics people, when we should instead be focusing on hospital strain. The number of deaths among recent cases is less than 1 in 1,000. This data reflects a disease much less severe than the average annual flu. The media reaction to these cases, for example, with the gravity appropriate to reporting deaths from a major catastrophe, borders on hysteria. Opening a newscast with a number of people testing positive for a condition less dangerous than the flu, which many don't even know they have, is scaremongering. The Irish Times also reports on Dr. Alan Farrell, quote, "From a medical perspective, I am not seeing an impact from COVID on the ground. What I am seeing is delayed diagnosis for other conditions, breast cancer, skin cancer in young people, an onslaught of anxiety and depression, an increase in loneliness in the elderly. Recently, a fractured humerus in an elderly lady that has been like that for months as she was afraid to go outside," end quote. There are prominent doctors in the United States and around the world who concur with their Irish colleagues. However, they are shunned, demoted, fired, smeared, and even brought before state medical boards for expressing their professional opinions based on personal experience and evidence. I've also seen evidence of inflated death figures using COVID-19 as a cause of death, even if it's only presumed. We're changing our way of life because of presumed deaths and inadequate information. My question is, have you or any of your staff done any independent research on the information that is being used to demand lockdowns and social restructuring, while at the same time destroying the working class and our children's future? If I would have had time, I would have slid this one in too. Has anyone done any research on the health hazard of wearing a mask? Peer-reviewed studies that conclude wearing a mask increases infection risk while providing no protection from transmitting or contracting any virus, including COVID. A study in the National Institute of Health, National Institute of Medicine on April 22, 2015, concludes, the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Further research is needed to confirm the widespread use of cloth masks globally. However, as a precautionary measure, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. So that would have been my question for the town hall that I kicked myself out of. I will be sending this to Congressman Wild as well as a couple friends of mine in labor, because I think we need to start a dialogue on how we're going to combat this. This isn't going to go away, and it's not what we think. And I think it's time we have to start informing the memberships of the locals in the labor movement of some of the information that's being suppressed in the United States so they can make informed decisions, because they're going to have to make some big decisions coming up, including whether or not to let their children take a vaccine that was forced through in 6 months. So that's about all I have. If you have any comments, please leave them in the comment section below. Pro and con is invited, and I hope we can get a dialogue started where we can start taking some action. So that's about all I have. I'm signing out.